Moving on to the last section of this chapter, infectious disorders. The first disorder is impetigo. This is a superficial bacterial skin infection, usually due to Staph aureus or Strep pyogenes, and it commonly infects children. In fact, it's extremely contagious. It presents as erythematous macules. Remember that a macule is a flat lesion that progress to pustules. A pustule is a raised lesion that contains pus. Of course, there's bacteria here, so you're going to get some pus. Usually occurs on the face. It'll result in an erosion with this dry, crusted, honey-colored serum on the surface. And so that's the classic finding in impetigo. Cellulitis is also due to Staph aureus or Strep pyogenes. However, instead you get a deeper infection within the dermis. And this presents as a tender, red, swollen rash with fever. The risk factors include recent surgery that would introduce bacteria to the dermis, trauma, which could introduce bacteria to the dermis, or, for example, an insect bite, which could also introduce bacteria to the dermis. Now, this can then progress to necrotizing fasciitis, where you get necrosis of subcutaneous tissue underneath the dermis due to infection with anaerobic flesh-eating bacteria. Of course, these anaerobic flesh-eating bacteria would produce CO2, and that would lead to crepitus, where you could feel gas within the skin. You could feel the bubbles of gas within skin, and this is a surgical emergency. Staphylococcal scalded skin syndrome is when you get a staph infection of the skin. It's usually the very superficial layers of the skin. That staph produces exfoliative A and B toxins, which then results in the lysis of the skin and a separation of the layers of the skin, giving a scalded appearance. And so what you're going to get clinically is sloughing of the skin with an erythematous rash. It occurs diffusely across the skin, giving you significant skin loss. This is again due to a Staph aureus infection. It produces exfoliative A and B toxins that then separate the stratum granulosum from the rest of the skin. Now remember that the stratum granulosum is way up at the top of the skin. You've got your basal layer, then you've got your stratum spinosum or the spinal layer with the desmosomes, and then you've got your stratum granulosum or the granular layer, and then finally you've got your stratum corneum. And so what's happening here is that you're getting separation very superficially at the layer of the stratum granulosum. And it's important to note where this is occurring because you need to distinguish it from toxic epidermal necrolysis, where you also get massive sloughing off of the skin. However, in toxic epidermal necrolysis, you're separating at the dermal-epidermal junction, and so it's a much deeper separation. Verruca is a term that refers to warts. This is a flesh-colored papule, or a raised lesion with a rough surface. It's due to HPV, and the hands and feet are a particularly common location. Here's a classic picture of a wart or a verruca, and again, this is due to HPV. You can see that it's got a rough surface, and it's a raised papule. The final lesion is molluscum contagiosum. This refers to a firm, pink, umbilicated papule, and it's due to pox virus. This most often arises in children, but it can occur in sexually active adults. It can be sexually transmitted, actually, and it can also arise in immunocompromised individuals. Now, the hallmark of this lesion is that you're going to see molluscum bodies within the affected keratinocyte. Again, this is a sign that these keratinocytes are infected with pox virus. And so here are the molluscum bodies indicative of viral inclusions. And again, the key virus, pox virus. And that concludes both this section and the chapter.